There's around 3,500 children a year die in Canada. When you consider how many actually have pediatric palliative care, you're looking at roughly 10%. There's not nearly as many children have palliative care services, partly because, as I've said, the clinicians are not quite as quick to involve palliative care, because it seems to many people that palliative care means you're giving up. It means that you don't care anymore, you're just going to stop. Which, for us, those of us who know about it, then know that's absolutely not the case at all. It's about caring till the very end. It's about caring through into bereavement. It's about providing the families with everything that you can to support their physical, psychosocial, emotional, their whole being, not just focusing on pain control. It's everything. It may be about not using technology in the same way, but that doesn't mean to say you don't still care. It's a very important difference. Interestingly, in pediatric palliative care, I think people tend to have the idea that it's mostly children who have cancer, but that actually isn't the case at all. Roughly about 50% of the children who can benefit from pediatric palliative care have progressive diseases, neurological, metabolic, genetic type diseases, where you're not talking about there being even a possibility of a cure. That occasionally there is something that is tried towards cure, but for many of these children there is nothing. There's nothing they can do for them. There may only be 100 children in the whole world with a particular disease, but when you take them together as a group, it's about 50% of the children who should be getting pediatric palliative care. So they have a longer trajectory in most cases. They may be diagnosed soon after birth, usually within about 5 years, but not necessarily, but often it's, within about a year of birth. Sometimes a child is perfectly normal for 2, 3, 4, 5 years, and then something seems to change and the parents notice a difference. You know that eventually this child will die. And the phrase that I have used is about certain death, but at an uncertain time. So you know that the child is going to die. And there's a lot that can be done within palliative care to help families find ways of living life to the full until the child dies. Pediatric palliative care can really make a difference in families' lives. It can make a difference in helping educate other professionals as well, because whatever we're doing in our practice, it should be about trying to provide optimal care. And pediatric palliative care absolutely can do that. Yeah.